Hi, this is David Roth and Dr. Richard Horowitz. We are going to do, I think, a half an hour session here talking about Lyme and COVID. I should introduce myself as somebody who is both historically a Lyme and Babesia sufferer. I am currently the head of the executive committee for Project Lyme and have been involved in advocacy on behalf of the Lyme community since 2010 when I was originally sick. And then I must be, infectious diseases must like me a lot, because a month ago I was infected with the COVID virus. So I'm on, I think it's day 24 now, and we can, after Dr. Horowitz has introduced himself, we can talk about my experiences and thoughts around that and what I'm continuing to go through. Doc?
Yeah, thank you, David. Yes, I think most people know me. My name is Dr. Richard Horowitz. I'm a board-certified internist. I live and work in the Hudson Valley, New York. I've been working for HHS for the past several years. I was one of the initial members of the Tick-Borne Disease Working Group. I was co-chair of the other tick-borne diseases and co-infections subcommittee, and recently just was on the HHS Babesia and Tick-Borne Pathogen subcommittee. At this point, I've treated, I believe, 5 or 6 COVID-19 patients. David, you were actually one of the first people that I was starting to treat. And what we'd like to do today is discuss a little bit of David's course, what the symptoms that people have, some of the biochemical pathways of how people get sick, and some novel methods that I've been able to discover that I think will make a difference, not just for David, but for many of you who are listening. So David, why don't you tell him your story a little bit?
Sure. I mean, I had largely gotten better from my Lyme and with the help of Dr. Horowitz, my Lyme and Babesia several years ago, although I have had some ongoing issues that, that it's funny, I visited Dr. Horowitz for the first time in a fairly long period of time, about 2 months or a month before coming down with COVID, because I had some stuff that was going on and I wanted to look into it. But aside from that, I was totally healthy, and I had dinner a month ago this past Friday, 5 weeks ago this past Friday, with a friend of mine who sat at a sushi bar about a foot away from me, and the next day came down with what ended up being COVID. It took about 10 days for me to show symptoms, and this was, 3 Fridays ago. I started to show a fever and a sort of flu-like symptoms. I also had diarrhea, which is, they're starting to learn, is fairly common as well. I immediately went into the hospital. This was fairly early in New York in terms of what's going on now. It was March 14th. I went into the hospital on a Saturday, and they tested me for all types of respiratory issues and the flu and other things. And they took a swab for COVID, and they told me they weren't going to give me, they weren't going to send the COVID panel in unless everything else came back negative, which it did. They sent the panel in, and on Thursday, this was now a 5-day turnaround or something like that, I actually got a positive test result. And I had been talking to Dr. Horowitz a bit before then, but, we kind of, attacked it in earnest at that point. The punchline is I was very sick through day 14 or 15, which would have been a week ago Saturday. And then I started to recover, and I slowly have gotten better every day. I continue to have a lot of fatigue and exhaustion, and at night I've been having continuing night sweats and a little bit of air hunger. And we can go into, and maybe use this, Doc, as a way to talk about the various aspects of this from a medical standpoint. But I am happy to report that I definitely feel like I'm on the mend. You always are a little careful with this disease, and even saying that, because it is an illness where there's often head fakes, where you feel like you're getting better, and then all of a sudden you start to get worse. So you keep wondering if the shoe's going to fall again, but I generally, I think I'm moving in the right direction.
Thank you. Yeah, so for people listening, as far as the symptoms, David was describing some of the classic ones of his fever, cough, shortness of breath, and diarrhea. But the other things, the prodromal symptoms, people really should know that if you lose your sense of smell or taste, that is actually one of the earliest signs of COVID-19. And David, you had said that you did start also to have that. You'll also see a sore throat, headaches, muscle pains. Very rarely they've told people you can get a conjunctivitis. And the highest risk people that are normally going to get fulminant disease, the worst are going to be males. It turns out actually is a risk factor. Those of advanced age, 65 or older, smoking history, hypertension, cardiac disease, obesity, patients who've had strokes, underlying respiratory illness like asthma, emphysema, cancer, immunosuppression, but also secondary infections, apart from like chronic kidney and liver disease. And, the secondary infections, I think, for the Lyme community is the big thing that people are worrying about. And we published a study, Dr. Freeman and I published a study in 2019 that we found that about 7% of our chronically ill patients had CVID, chronic variable immune deficiency. Their total IgG antibodies were low. They had very high levels of subclass deficiencies in 1 and 3, which you need to get rid of infections. So for those listening, if you've not had your immunoglobulins checked in subclasses, and even your natural killer cells and natural killer cell function, if you've not had your zinc levels checked, because we're going to talk a little bit about what I gave to David and what I think may be helping people, it's very important to get these checked, although of course for now for the laboratories, most people are staying at home. But the mortality rates of this disease, I think no one was taking it that seriously, maybe initially when it came out, but the gross fatality for all groups worldwide in end of February was like 3.5%, but now towards the end of March, it was actually 5.7%. This is the WHO, the World Health Organization. So, Italy has been quite high with Spain. I mean, I think they're at 10, 11%. So when we're talking about social distancing, when we're talking about wearing a mask outside, it is very, very important if you have any of these symptoms at all of loss of sense of smell or taste, of fevers, cough, and it's not easy to get tested. Right, David? I mean, look, they took days to get your test done. I have patients who are calling me, do they have any drive-throughs, right? There's not that many even in New York State at this point.
I think it's almost impossible to get tested right now from what I gather, unless you are literally at the point where you have so little ability to bring in oxygen that you're being admitted to the hospital. And I think it's important to note that, and I got really, we could talk about the progression of the disease. I had 5 or 6 days where I was, kind of flu-like symptoms, and I did have like these scalp headaches that were very reminiscent, frankly, of when I had Lyme and Babesia.
And the sweats also, David, right? Those sweats were really significant for you.
Yeah. And I had that for like 5 or 6 days, but never anything that I thought was life-threatening. And then on Thursday night after the Friday that I started to get ill, so 6 days in, and I think this is a fairly common thing, I started to take a turn for the worst. And I ended up, in the hospital trying to determine whether I, was having enough trouble breathing to get admitted to the hospital, because if you don't know, you don't know. And, they basically said, look, they discharged me and they said, if you have enough breath to actually speak a sentence, you're not getting admitted to the hospital right now. So this is for many, many people, and I would suggest you don't want to go to the hospital if you can avoid it anyway, but for many, many people, this is something that they're going to experience largely at home.
And, one of the things, I mean, I don't get very scared as a physician. I've been doing this for a long time, but you did concern me towards around 10 day or 11 of the illness, which was kind of when it peaks for most people with the consolidation on the lungs and the ground glass appearance. You were really starting to get, short of breath with the dyspnea, and it was concerning. And what I want to share with people is what worked for you, because what we did for David, just so you know, the regimen that I had him on was the Plaquenil hydroxychloroquine. We did a loading dose of 400 milligrams twice a day, and then followed it for 10 days for 9 days at 3 times a day, so 600 milligrams. And by the way, the talks about Plaquenil and worried about retinal problems, I've been using Plaquenil for 30 years. I've never seen anyone have a retinal problem for short-term Plaquenil.
Yeah, I was when I was sick, I was, you know, with Lyme and Babesia, I was on Plaquenil for over a year.
Yeah,
so.
as are many patients. And we gave you Zithromax, right? So also there was 500 a day, so that was for 10 days. But the one other drug we gave, and I gave you Alinea nitazoxanide because it was published against SARS and MERS viruses, Middle East respiratory viruses. It was effective, and the genome for this COVID-19 is also going to be, the genome I think was about 2/3 the same genome. So we gave you a 5-day course of Alinea nitazoxanide, 500 milligrams twice a day. What's interesting about the drug, apart from hitting the viral replication, is it lowers interleukin-6. The reason people get sick from this illness, it's called cytokine storm syndrome. Now, all the Lyme patients listening, Herxheimer reactions are cytokine storms. So the cytokines, these inflammatory molecules we get with COVID-19, tumor necrosis factor alpha, TNF alpha, interleukin-1 beta, IL-6, IL-8, these are the same cytokines that Lyme patients get. So what we gave to David for this was not only the antibiotics, but N-acetylcysteine, 600 milligrams twice a day, alpha-lipoic acid, 600 milligrams twice a day, and glutathione. And David, why don't you tell him when you took 2 grams of glutathione all at once for the first time, why don't you tell him your experience of how it went for the shortness of breath?
Yeah, I mean, look, and this issue of cytokine storm, that was what my biggest concern was, because I know that I've had ongoing issues around cytokine and chemokine buildup. I've had blood tests, this Luminex panel, which some people have had. So I know that I have this issue, and that made me nervous going into this. Doctor, you should talk about, you really didn't think that necessarily my Lyme in the past was going to make, the disease worse. It wasn't necessarily a precondition in the way we're talking about preconditions now of heart disease and diabetes.
Right. The only concern I had for you specifically, though, is that you had inflammatory markers in your blood, right? The rheumatoid, you don't have rheumatoid arthritis, but the rheumatoid factors are up, and you see that in Lyme patients, and your anti-nuclear antibodies were up. And we see that in Lyme patients too, without having necessarily rheumatoid arthritis or lupus. So my concern actually looking at your markers, though, is you were coming in with inflammation and there was some mercury. You happen to love fish, so do I. I just cut back on it when my mercury levels were high, but yours were high in the blood. So hopefully you're cutting back on mercury at this point. But there were those risk factors for oxidative stress, right? That there was an inflammatory process going in. And that was actually one of my biggest concerns for you, not that you were a smoker or had hypertension, but it was the inflammation going into the illness. Yeah. Yeah.
Look, I should say that I didn't have any of the other, I'm not a smoker. I could lose a few pounds, but I'm not necessarily overweight and certainly not diabetic or have known heart disease. I will tell you that at the peak of it, when you talk about like day 12, day 13, which for me was really the worst moment, I was almost we didn't really talk about this, but I was very scared of heart issues. Mm-hmm. I just felt like I wasn't getting a lot of oxygen. You never know the sort of silent triggers that might occur.
No, and one of the complications of this disease, they call it fulminant myocarditis. You get inflammation in the heart, you can get inflammation in a lot of the organs. But I'd like to go back, David, to when you were at your peak with the shortness of breath. Tell people your experience of alkalizing, like with Alka-Seltzer Gold and 2 grams of glutathione. Tell them your experience.
Yeah, I mean, look, I'd had a good experience with glutathione and Alka-Seltzer alkalizing when I was sick with Lyme. And I found sort of the same thing here. When I took, there were 8 pills to get to 2 grams of oral glutathione, that actually, had a fairly immediate positive impact for me. So I would do it twice a day. Later on, I actually hired somebody to come in and give me infusions, which Dr. Horowitz prescribed of I think we were on saline with, some minerals. And
well, you were sweating so much with diarrhea, you were getting severely dehydrated. So we needed to get fluids into you, right?
Yeah, by the way, that I think is, for those of you who go through this, you literally, I don't think you can get enough liquids. Like, I'm pretty sure I was fully dehydrated for about a week of the experience. So, anything you can do, I was drinking Pedialyte, which is, a high electrolyte content, but lower sugar than, something like Gatorade. I was drinking a ton of that, and I still was not getting enough liquids. And when I finally had the infusion, and it's a luxury to be able to do that, I had somebody come in and give that to me. That helped a lot, actually.
And you had the glutathione also in the fluid. So
yeah.
You thought the IV glutathione even was a little bit more effective than the oral, right?
It was.
Yeah. So, what's interesting is, and these are in both of my books, Why Can I Get Better and How Can I Get Better? It's very interesting that the biochemical pathways of inflammation with COVID-19 are exactly the same. And it's called, and there's two of them I just want to highlight for people listening, for doctors and patients. It's called NF-kappa B. You'll read about it in my books under inflammation and autoimmunity, and NRF2 activators. So what we gave to you to block NF-kappa B, which is the switch inside the nucleus, if you turn that on, all these inflammatory molecules, the cytokines, come rushing out. So you block that with NAC, alpha lipoic acid, and glutathione. And then we gave you zinc at around 40, 50 milligrams a day. Vitamin C was 1 gram 3 times a day, but for pneumonia, we upped it to 2 grams 3 times per day. And then also we were using curcumin, because turmeric, curcumin, is an NRF2 activator, as is broccoli seed extract, sulforaphane glucosinolate. So what NRF2 activation does is it lowers inflammation. So we were attacking this by blocking the switch that turns on inflammation, right? And then also hitting NRF2 to lower it, while giving you Alinea, which lowers IL-6 using the Plaquenil Zithromax. And it turned out it was, of course, very successful. I mean, I was worried in the middle, and I was so happy when you told me you felt so much better with the glutathione.
Yeah, no, look, it was as bad an experience as I've had, and I've had a lot of them because of, Lyme and Babesia. A lot of it felt somewhat similar. I'm not sure if it's because of the cytokine aspect of it, or just the inflammatory response being the sort of big problem. A lot of it felt very similar to when I was really sick with Lyme. I had a lot of the same, I would say, body aches, the same kind of scalp headaches that I got, same kind of night sweats, and the air hunger was pretty familiar to me.
Yeah. And what I think is going to be important, and this is my hope, because before we got on, I just told people that we submitted your case study and another one of a woman in Brooklyn who had exactly the same experience you did. She was on the antibiotics. She was on Plaquenil Zithromax. We added Alinea. She was getting somewhat better, but also very quickly, within 2 grams of oral glutathione, she was better. She repeated it in the morning, and she was able to do activities of daily living, take a shower, get up. She was unable to do that before using Glut. And, for the people on respirators, we're running out of respirators in New York. I mean, Governor Cuomo is doing an amazing job of coordinating this response. I mean, bravo, by the way, for anyone listening here in state government, amazing. But for the respirator, the problem is for ARDS, acute respiratory distress syndrome, and this is what's fascinating. What they found is that it's low glutathione levels that show up in the lung tissue, in the blood, and in the red cells of these people who have acute respiratory distress syndrome. And also, it's amazing, and also have viral bacterial pneumonia. So there's a lot of cytokines with low glutathione, so we might be able to save people's lives by giving them glutathione IV. Let's say they're on a respirator, and this is a controlled randomized study we're going to have to do, but I put it through the journal. It looks like they're fast tracking it. So I'm hoping we're going to have a journal article out pretty quickly, so then we can do randomized controlled trials and see if maybe we can get people, stopping them from getting on ventilators and improve them, because the glutathione is actually low in this disease in the blood and in the lung tissue. And I didn't know that until I started doing a PubMed search, right, to realize it's the same cytokines as Lyme. And we do see low glutathione, right?
Worth mentioning that what I'm hearing is it's almost impossible to get Plaquenil now, mm-hmm. which is, it's obviously, it's a shame for, and I think you can attribute this to, I think, the president getting on television telling everybody it's a wonder drug, and everybody then went and got a prescription, and all of a sudden nobody can get it. But it's a terrible thing for those going through this if they can't get it. I have a coworker now who's on day 7, can't find Plaquenil. And then, of course, there's like all the rest of us who were on Plaquenil for other immune issues. So
the way the FDA regulation came out, though, they changed it, is, first of all, if you have a pre-existing condition like rheumatoid arthritis, lupus, you can get it. But I also saw something a few days ago from the FDA. Lyme arthritis, so it's been published by Alan Steer and others that Plaquenil is used for Lyme arthritis. And so if you have a pre-existing condition with Lyme arthritis and your doctor can document it, you should be telling this to your pharmacist to get it approved. That's at least the understanding I have right now. But I want to be clear to people, even if you can't get it, the regimen we gave to David using Zithromax with Alinea and the new drug that just came out this weekend that looks like it has effect also is ivermectin. Ivermectin is an anti-parasitic drug that we have been using actually in our practice for years. It turns out that ivermectin also has an effect on the COVID virus. We need to do clinical studies, but it's a very safe and well-tolerated medication. So, you know, you could theoretically do ivermectin and Zithromax. You could do Alinea and Zithromax with NAC alpha-lipoic acid glutathione. The only people that have to be careful with glutathione, by the way, IV, if you're chemically sensitive, some chemically sensitive people that are sulfur allergic, you want to be careful using it. Orally, it's not usually a problem, but you have to be careful IV. And for people that have a possibility of hypoglycemia, of low blood sugar, you have to be careful when you use alpha-lipoic acid at 1,200 milligrams. But that being said, 99.9% of my patients who've taken this, over 13,000 over the years, tolerate this regimen. So if you do curcumin and broccoli seed extracts, right? And we were also using beta-glucan, 3,6-beta-glucan helps the immune system and natural killer cells to fight viruses. Now, we don't know which part of this made you better. It could have been all of it, but I want to give hope to people out there because your improvement with glutathione almost immediately, and this woman also in Brooklyn, means we may have discovered something that will stop people having to go into the hospital in respiratory distress or get them off. And I'm praying at this point that it's going to work that way. So we'll see as time goes on, but at least it's encouraging.
So, you know, Doc, you also know I'm at Columbia getting a master's in public health as we speak. And many of the students, there's 30 students, many of them are doctors and nurses in the emergency room. So I'm in communication with all of them right now. Few of them have gotten sick. I think we have to give a massive shout out to the healthcare workers who are living through this. It is. I mean,
honestly, they've been called the heroes, but they are on the front lines giving their lives at this point. I mean, this is the highest point of medicine. I mean, when you go to med school and you take a Hippocratic oath of serving, right? I mean, this is the highest form of service because you are putting your life on the line for the community. So honestly, my love, my compassion, my great appreciation for all the people on the front line. Yes, David, it's a great point. Thank you for bringing that up. Yeah. So I
go ahead.
We're almost at a half hour. So, I mean, do you have anything else you'd like to share with people before we?
I mean, I'm going to avoid getting into the politics of all of it because it makes me very angry. So we'll stay away from that other than to say, I do think Cuomo's doing an amazing job here in the city. And, you know, despite all the challenges that are presented to governors at the state level, I mean, this really should be much more of a coordinated at the federal level effort, and there's no leadership being shown there. So
and you know, I would hope maybe Governor Cuomo can do the same. I've seen there's states in the United States that are not following the strict guidelines. There are people still going to bars and restaurants, and social isolation and putting yourself at home is the only way you're going to shut this down. And my concern is if people don't wear the masks that are now being recommended with the distancing and stay indoors, you know, we're going to be hitting the peak of the virus from what I've heard this week in New York City, pretty much, right? They're expecting the death rates. And that's why I wanted this article to be published. But people, you've got to stay indoors. You've got to follow the guidelines from the CDC, you know, on this one. This is not an option, right? You could be putting other people's lives at risk. So I just want to say that. And just finally, because I did say about the HHS affiliation, that of course, what I'm saying today, these are my opinions. These do not reflect the opinions at all of HHS, the Tick-Borne Working Group, the United States. The lawyers for HHS always make me say that. So I just want to be clear. These are my opinions, not HHS. But David, I'm so happy you're feeling better. Honestly, I haven't gone through these kind of a life, you know, threatening situation as a physician in a while. So it was not easy, but I can't tell you how happy I am that, you know, you're feeling so much better.
And I can't, you know, look, I can't tell you how happy I was to have you taking care of me. And it's a, you know, for those that go through it, it's a really hard thing. And, you know, there's a mental aspect of it that is really difficult because, you know, on day 6, you're going to get worse. And you know that if you can just make it to day 14 without going to the hospital, you'll probably be okay. So every day is like takes a year. So it's a really tough thing to go through. So I feel for everybody who goes through it.
Yeah.
The extent that you do go through it, I hope we come out with a superpower and we can help society. I would suggest that people should give blood, although I was going to ask you, given my babesia, whether I can give blood, but, give blood to efforts like convalescent therapy and things that are.
Yeah, my concern right now is your night sweats and air high. They're very reminiscent of your babesia. We can't test right now, but yeah, if anyone has had it, you've got to be careful with. But you're correct. I mean, we're going to need the resources all over. So, good. So I just want to send my blessings, my good wishes to everyone out there. We're all going through a tremendously difficult time. My heart is with you. You have my compassion, my empathy, as do all the people listening, and we just send you blessings and hope everyone will stay well.
I agree.
Thank you, David, for doing this. It's good speaking to you.
Thanks, Doc.